Welcome everyone to this webinar on organic acids. I'm Anne-Catherine, co-founder of Nordic Laboratories and DNA Life, where we are dedicated to support health and optimization of health through functional medicine and personalized medicine. And of course, we offer lots of different laboratory tests and lots of different supplements in our VMS portal that you as practitioners and professionals should have access to. And if you don't, please reach out so we can help you and support you. So yeah, today is in organic acid, in the name of organic acids, you can say. And that's a test that I have been personally working with in the clinic for probably 20 years. So I have a lot of experience with it. But I know Genova has made some changes and some edits to the organics test. Yeah, so in that kind of phase, we thought it would be a great idea to go in and have a basic webinar about organic acids and the organics test. So that's what we are doing now. And then we will also invite you for a follow-up webinar in the new year, where we're gonna, oh no, I'm saying we, but where Dr. Powell will go in and do more cases and do a more in-depth presentation, more like, and focusing more on perhaps like the clinical side of the test. So before I just do the introduction to Dr. Powell, I just want you to know that next week we have a webinar on mold and mold toxicity testing. And then on the 30th of November, I'm really excited about that. We have Leslie Stones and Emily Ridbaum coming in to do a presentation on the Grow Baby genetic test that we are offering. So put that in the calendar as well for you to attend. But today we have Dr. Lahnor Powell, who's a naturopathic doctor specializing in integrative medicine, gastrointestinal health, women's medicine, and clinical nutrition. It just sounds like walking into a candy store, what you work with, for me, for sure. Topics that are so exciting. She also holds a master's in public health from University of Alabama at Birmingham. And yeah, she works as a medical educator specialist at Genova Diagnostics. And that's why she has been invited today to help us understand organics a bit better and give us some clinical pearls when we are sitting with our patients looking at organic acid testing. So Dr. Powell, I will pass on the stage to you and you can share the screen. I will be quiet. We are recording, everyone, so we will send out the recording and hopefully we will get the slides from Dr. Powell so we can share those a little bit later during next week or something. And also, if you have questions, put them in the chat box, then I will take note of them. And then at the end of the presentation, we will do Q&A as we normally do. So I'll zip it up now and you take on the stage.
All right, awesome. I hope everybody is doing well. And I believe you're able to see my screen. Is that correct? All right, awesome. So thank you so much for the introduction. That was really kind of you. And I am going to be doing a two-part series discussing the organic acids. And there has been some recent updates with Genova Diagnostics, and I'm going to step you guys through those. And so for today, I really wanted to kind of focus on kind of some background behind organic acids. And I always tell people that organic acid testing is not a new medicine. Or a new technology. This is something that we have been using for years upon years, especially when you have a newborn baby and we do inborn error of genetic testing. A lot of times we're taking advantage of organic acids. The difference is that with the newborns, we're basically looking for collapses of pathways, and with using it for nutrition, we're looking for insufficiencies. And so whenever you have an insufficiency of a particular pathway, how can we help improve that pathway? A lot of times the answer is going to lie within the answer of vitamins and minerals. So that's what the organic acids, that's how it's really been formulated to really help us understand our patients' need for certain nutrients. So for today, we're going to go over these 4 concepts: the who, the what, the when, the why. And then we're going to go a little bit more in depth and go into these 3 functional pillars that you see on the Organix profile: the mitochondria support, the toxic exposure, and the methylation imbalance. Now, I know that some of the participants are familiar with the Metabolomics Plus profile. They might also order that. And so although we're only going to be focusing today on the organic acids, I will bring in how those 2 tests are a little bit different, but how you might consider one or the other. We'll kind of talk about that, but definitely drop your questions into the chat box. And at the end of our conversation, I'll try to hit as many questions as possible. And I'm one of the people that if I don't know the answer, I'm not going to make something up. So if I don't know the answer, then I will make sure I get back to you at a later date through email or something like that. So I'll be very transparent in that aspect. So let's start off with this idea of, well, who can benefit from organic acid testing? So when I think about this question, I really think about those who have chronic health conditions. So if you think about those who have like your chronic diseases, cardiovascular disease, your diabetes, your learning or behavior challenges, a lot of times it can be rooted in not having adequate nutrients. And if we're able to meet that patient's basic nutrient demand, it either can lessen the severity of that chronic disease or it can totally just kind of take care of it, right? I think about women's and men's health as well, especially women as they transition into, let's say, just having their menstrual cycle and the changes in hormones that we might experience. And for me particularly, I love those women who are interested in, preconception counseling. Nutrition testing is great for those women. Women who, after they have a baby and they're in that postpartum time frame and they're losing hair or their brain doesn't feel as sharp as they used to be. Again, nutrition testing can be very helpful, even entering into perimenopause, menopause. And for men's health, the whole, they call it andropause here, where men kind of cross over into that, 50 age range, and they're starting to experience changes as well. And, when you think about the timeline of life for a human, things change. Your hormone levels change, your ability to digest, absorb your foods change, your stress levels change, life events happen, and all of these things can either lead to an increased demand for the nutrients that if we don't meet, then there could be challenges. Pediatric considerations, so developmental concerns, nutritional deficiencies, behavioral learning difficulties. A lot of times we'll see that those kids don't have adequate amino acids, and that could be the reason why they are having mood changes. We might also see that they don't have adequate fish oil, EPA, DHA, or they're lacking certain B vitamins that can contribute to a change in your mood. So using, testing for nutrition for pediatrics is actually a great consideration. I work with quite a few clinicians who specialize in peds, and they specialize in mood disorders, but also I work with a lot of clinicians who specialize in kids who are showing really high athletic abilities and just wanting to support them throughout their athletic journey. aging population. So we know that when you're elderly, let's take females, for example, you do not need the same amount of iron as you needed when you were in your, menstrual cycle days. So there are changes to your nutrient demands as we age as well. And then athletes and active individuals. So if you're training for a marathon, or we have testing, and we work with clinicians who work with patients who are in the military a lot, who are professional athletes, who are in the Olympics and the Paralympics, and those who are just doing, CrossFitting, different things like that. So we work with extreme athletes and those who are just, doing exercise on a regular or weekly occasion. And their nutrient demand is different than our non-athletic individuals. And so again, utilizing nutrition testing can help that patient hit that peak performance that they are looking for. But also assist in recovery. And I always tell athlete patients, your performance is only going to be as good as your ability to recover. So if you have poor recovery, then your performance is going to be poor. So again, nutrition testing can help with that, as well as just good preventative health and just good proactive health management. And so I know a lot of you guys have ran across those patients who just have a highly food processed terrible diet, and they're like, I'm tired, I can't sleep well, my mood is imbalanced. Well, yeah, it's because if you put junk in, you're going to get junk out, right? Whatever you put in, you're going to get out of that system, right? So if you put poor quality gas in a car, the car is going to operate poorly. Same thing with our human body. So again, these are the who can benefit from testing. Basically, I say if you walk and you eat food, you can benefit from nutrition testing, right? So what is the Organix Profile? So what it basically is a functional nutritional assessment. So let me kind of explain what that means. So you can directly measure something. Let's say you directly measure magnesium in red blood cells to tell you nutritionally, how are you doing with magnesium? But that only compares you to people of like age and like gender. You can still have issues with not enough magnesium for your individual physiology, despite your blood test saying that your levels of magnesium, in this case, are in range. So that's the difference between a functional assessment, where we're looking at your biochemical pathways to see how they're doing, versus just doing a static one-time blood measurement. So that's why we consider it to be more of an advanced diagnostic test, because we're looking again at those organic acids in urine. In the next slide, I'm going to go through a little bit more what an organic acid actually tells us and how it tells us these pieces of information. Again, where we're just reflecting what the metabolic processes are happening and how they're going within the body, looking at more of a cellular health status here. So the scope of the analysis, we're looking at over 70 different markers of metabolism. So we're looking at those for central energy production. So that would be like your citric acid cycle and how it produces ATP within your mitochondria. We're looking at detoxification markers that can not only tell us about how you're handling various metabolites of toxins, but how your antioxidant systems are working. We're looking at neurotransmitter breakdown. So do you have adequate amino acids, which are the precursor to the neurotransmitters, and do you have adequate cofactors to help your body move the transmitters to the next step? And then we're also looking at oxalate production markers. And so oxalates, a lot of us, I know me personally, when I was first introduced to oxalates, I really thought about it in relationship to yeast overgrowth. But when you look at the status of the current literature, when they talk about oxalates, they really talk about it in regards to kidney stone formation, metabolic syndrome, and needing certain cofactors. So that's what we tend to stress, what the current breadth of the literature says as it relates to oxalates. And then oxidative stress, are you showing us that you are making more free radicals? Because that could mean that you have an imbalance of your free radicals versus your antioxidant production. So like a redox imbalance here. And for oxidative stress markers, I always stress, for lack of a better word, why do you have it? Where is it coming from? So whenever I see oxidative stress, I always like to encourage people, start off with basic blood work, CBC, CMP, thyroid, ANA, fasting insulin. Let's just throw a wide net to see where might this oxidative stress be coming from. And if that's normal, that's great. But if not, we have something to work on. But also oxidative stress can come from training for a marathon, right? Because you have increased cellular respiration, which increases your reactive oxygen species production when you're training for something. So that could be a source of oxidative stress. That's not necessarily a bad thing, right? But also you can have oxidative stress from environmental exposures and infections, whether acute or chronic. And then for clinical utility, what I really appreciate about our profile is that it provides recommendations for vitamins, antioxidants, minerals, and if you run the metabolomics profile, it'll provide recommendations also for amino acids. But for both of the profiles, we also look at recommendations for digestive support. So in terms of clinical utility, you can literally apply the information and the recommendations that we make, and we expect your patients to experience some level of an improvement. But this is why our next conversation next year is going to be so critical, because I don't want you as clinicians to just look at our recommendations and just use it for your patients. I want you to use that as a guideline to help tailor your treatment protocols, right? This is where that personalized medicine really comes into play, because if you know your patient is on, let's say, metformin, for example, then you know that medication can deplete certain B vitamins, especially B9, B12. And so you would tailor the recommendations we make even further to make sure you're accounting for that medication. Or you can tailor the recommendations even further to make sure you're accounting for, oh, my patient has migraines, so let me align the amount of riboflavin or B2, what else? Omega-3s and magnesium with what the literature says could be helpful in individuals who have migraines, even arginine, right? So you can really further tailor things. And that's where I want to help get you guys to that level. So you can see, okay, the profile based on the results say this, but I know my patient has this, so let me recommend that, right? So that's what I want to eventually transition you guys into, being kind of more of like the experts in this profile to really optimize your patients. And then it assists in pinpointing the root cause of complex symptoms. So a lot of times it's rooted in not having adequate nutrition, right? So I just had a case I reviewed earlier, and it was so strange. You know, the client was dealing with this like new onset of mood changes, and they didn't understand why they were so depressed and just feeling low. And so they ran a nutrition panel. Actually, it was a metabolomics for this specific case that incorporates organic acids plus your amino acids. And we found out that the patient's amino acids were low. I mean, just totally crashed out. So we actually had to go back and say, okay, well, that could be why you have mood issues, but that could also be why you can't make the right antioxidants, right? So again, this complex symptom, I can't sleep, I have mood stuff going on, it was actually rooted in this patient's low amino acids. And now we need to investigate why those amino acids are low in the first place. And then we have this supports refined dietary and supplementation recommendations. So on our collection packet, it says that if you want to stop supplements before you do the test, it's up to you. If you have your patient stop supplements before the test for, let's say, about 4 days, it'll give you baseline information about what are soluble nutrients, where are they, what do they need. But if you want to refine your supplement recommendations, if you want to really further tailor it, then you can leave your patient on the regimen that you have them on, and the recommendations that are produced from the test, that's just things we need to add in addition to what you're already doing. So let me just kind of take a little quick step back and explain organic acids. So just to kind of make you aware of what we're seeing here on the screen, A converts to B, converts to C. You have enzyme E1, E2, and each enzyme requires a cofactor. Well, not all enzymes, but most of them require cofactors, and cofactors are just vitamin and minerals. And so in this example, if you do not have enough cofactors for enzyme 2, then B is not going to be able to convert into C. It's going to kind of build up. And when it builds up, we're going to have a higher urinary excretion of the metabolite B. And with that higher urinary excretion of metabolite B, we're able to go back to the enzyme or the pathway and say, enzyme E2, what do you need to convert into C? And that's what helps us to arrive at recommendations for the nutrients, because we understand if something is high or something is really low, we understand what enzyme is involved in that next step and how to really modulate it. So let's just use the example of methylmalonic acid. So here in this example, you'll see that methylmalonyl-CoA, it has the option to convert into methylmalonic acid or succinyl-CoA. So why would it go one way or the other? Well, if you don't have enough B12 for this enzyme, then your body is going to redirect methylmalonyl-CoA into methylmalonic acid. That's why with elevations of MMA or methylmalonic acid, it indicates the need for vitamin B12. That's why, because you are not able to move methylmalonyl-CoA down into succinyl-CoA because that enzyme does not have what it needs. So that's kind of how, like when you look at organic acids, that's the whole premises behind it. So now let's transition into, well, when do I consider testing? So these are some common conditions that's listed on the left-hand side of the slide: fatigue, stress, inflammation. But just to let you know, in the lab, the top 3 reasons this test or nutrition testing is ordered is number 1, fatigue, either a new onset or unexplained fatigue that we really can't figure out. Number 2 is going to be mood disorders. So a new onset of mood disorder or a mood disorder that's just not improving regardless of the therapies that we're doing, or people who are just looking for an alternative way to address mood disorders. And the last one are going to be our optimizers. So those are people who are training for some kind of an event, who are our athletes, or who are just looking to do a part of their life a little bit better than the prior part of their life, right? In terms of just health status wise. But if you look on the right-hand side, lifestyle. So I want to put under this nutrient depletion section, I want to highlight this idea of medications. So a lot of patients, especially the older individuals, our older adult patients, they tend to be on what we call polypharmacy, or a lot of medications. And when you're on several medications, you have to understand that it can impact your nutrients. Like we think about statin medications, it can impact CoQ10. We think about your not birth control, but even any hormone, even birth control, it can impact B vitamins and minerals. We think about your mood medications, it can impact not only amino acids, but also nutrients too. So when you have patients on multiple pharmaceutical medications, it's important to look at what are the possible nutrient deficiencies based on the medication they are taking. And then these special diets. There is a right and a wrong way to do every single diet that exists. So yesterday, I actually just reviewed a case where a patient was on a vegan diet. There's nothing wrong with a vegan diet. Please don't get me wrong. There is a right way to do it and a wrong way to do it. It just so happened that the patient's case that I was reviewing yesterday, they were doing it absolutely wrong. And they were doing more of a higher carbohydrate diet and just avoiding animal products. But there was really no legumes, there was no beans, there was really no fermented foods. It was highly processed vegan diet. And when we looked at their nutrients, I looked at the profile and I said, your patient has a lot of deficiencies. Amino acids were crashed out. The B vitamins were crashed out, which was weird because and the antioxidants were even crashed out, which is weird. They were really low. But in a vegan diet, you would expect for certain B vitamins and certain antioxidants to actually be plentiful, but not in this case. And so I was reviewing the case and I asked the client or the clinician I was talking to, I said, is this patient cranky, moody, tired all the time? And they were like, that's exactly it. And I was like, okay, it's because their diet, the way they're interpreting it, it's not appropriate, right? So that's something very important I always like to stress. And then also under nutrient depletions, you have GI surgeries. That's especially your people who've had a gastric bypass. So there's 2 different types of bypass surgeries, you have the restrictive one, and then you have the malabsorption one. So the restrictive one is where they just kind of staple and make the stomach a little bit tighter, or they do a lap band. But the restrictive is when they actually will re-divert the stomach down to a lower part of the small intestine. So they're avoiding a lot of that absorption in the small intestines. So according to the American Gastroenterology University kind of people, they have determined that for people who've had GI surgeries, even gallbladder removal, which is actually really common, which is crazy, but it's common, that they should have nutrition testing done on a yearly basis. I actually just reviewed a test earlier today also. Patient had a gallbladder removal. Nobody ever told them about how it impacts how you process your fats. And so this patient was spilling out fats in their stool, had a lot of GI issues going on, and they had like a vitamin D level of a 31. And we like that to be around 50, 60, 70. So I was like, well, that's fat soluble, so it makes sense, right? So, just being mindful of patients who've had these types of surgeries as well. And so why choose the organics, right? So a lot of things you're going to hear me repeat here, because a lot of the who's and the whys and the what's, we're also going to see it in this section. But I think for me, it's really going to be detecting those nuances, those small changes that are not visible in standard tests. Because again, a standard test might say you have enough B12. A standard test might say you have enough magnesium, but we're able to detect those small nuances and clinical relevance. If we're able to detect those small nuances and you replace those nutrients, it's going to impact your patient's health. And then also it can help us identify early signs of metabolic disturbances. And so on our talk that we're going to go over next year, believe it or not, that's in like a few weeks, which is crazy. We're going to talk about how and what certain patterns we look for that can actually indicate metabolic disturbances. Because believe it or not, you can look at somebody's citric acid cycle and understand that you don't handle glucose very well, right? So we're going to point out those small those small changes that might indicate a really big metabolic issue. And then the data is actionable, right? We give you recommendations. And for those who are familiar with the profile, we also tell patients, this is what vitamin A or whatever does. We say, this is why you might be deficient. This is what happens if you're deficient. Now go eat this. So these are the foods that are rich in that specific nutrient. So very actionable data. And then it's going to improve your patient's outcomes and compliance. A lot of patients, they want to see data. And then when you tell them, take this supplement, and then when you retest in about 6 months to a year, and they see an improvement in their test, that improves compliance. They want to, stay on the target or the path or the treatment protocol. So it's beyond traditional testing. And hopefully at this point, everybody understands what I mean by that. We're not just focusing on disease. We're not just focusing on you don't have enough vitamin C, so you're going to get scurvy. That's what standard blood tests are for, okay? We're looking for insufficiencies. We're looking for you have high oxidative stress, so that could indicate that you need more vitamin C or antioxidants. Again, we're measuring those metabolic byproducts for a deeper health analysis. It's more of a proactive health management kind of thing when we're looking at organic acids and when we're suggesting these various nutrient recommendations. And then it's used in synergy a lot with your standard practices, right? So let me just say, for example, if you have a patient that has a thyroid dysfunction where their thyroid is underperforming, when you do nutrition testing, we look for things like zinc, we look for vitamin A, and we look for selenium and tyrosine, nutrients that can help support the thyroid, right? So that's how it's used in synergy with your standard practices. And then again, enhancing patient care as well. So when I say personalized treatment, this is what I'm talking about. This is the page that you can literally apply for your patients. It's based on the results of the test, and we do expect there to be improvements. But if you're able to catch the little small, but you have let's use a different example. Let's say you have a high homocysteine. Well, then we can match the amount of B12 and B9 to the right form, which is the methylated form. We might increase the dosage because we want that homocysteine level to go back into normal range because of all the cardiovascular risk factors, right? That's why on the far right side, we have this blank column where you can tailor the recommendations even further. But we have the antioxidants, B vitamins, minerals, GI support, and we give you in the green, it would mean that you have a normal need, whatever you're doing, great job, keep going. The yellow means you have a higher need above what you're already doing, and red means that you have a high need. And then we give you the suggested recommendations. Now the DRIs, that's just how many milligrams, micrograms, or whatever you need of that nutrient so you do not get disease. So this is the bare minimum, okay? So again, we're assessing the body's need for all of these various sections, and then we have these functional pillars also built in a scoring system. So green, 0 to 4 is minimal need for support, 5 to 7 is moderate need for support, and 8 to 10 indicates that we have a high need for support. So we're going to transition now into looking at these pillars in more detail. So the first pillar was the mitochondrial dysfunction pillar. And so we know that the mitochondria is an organelle or a part of the cell. Certain cells in your muscle tissue, they're going to have more mitochondria than cells in other places of the body. But it basically, its role is to take the foods we eat after it's been digested, absorbed, metabolize it so we can produce ATP or energy. That's the major job here. And so when we have abnormalities within the mitochondria pillar, it can reflect that we don't have enough nutrients or vitamins. So a lot of nutrients like your B vitamins like B1, 2, 3, 5, alpha lipoic acid are essential for the well functioning of your citric acid cycle, as well as things like magnesium and manganese. And for people who are deficient in iron, whether they're vegan, vegetarian, or females dealing with a lot of heavy blood loss during their menstrual cycle, or somebody who has blood loss for, a cancer reason or whatever, that iron deficiency can also impact how your body produces ATP through the mitochondria. And then we get to toxins, things like mercury, arsenic, aluminum, antimony, lead. If we're exposed to those toxic elements, that can also impact the various enzymes in our citric acid cycle and not allow us to make adequate ATP. And then genetic polymorphisms. You might have a genetic predisposition for a certain enzyme not to work very efficiently. Again, that will also impact how our mitochondria makes ATP. And the one thing that's not listed here that I think is worthwhile mentioning are medications, right? So medications, let's just use a statin, for example, or a beta blocker or a diabetes medication. All of them can impact CoQ10. Well, if you don't have adequate CoQ10, well, it's going to be really hard for your mitochondria to operate really well. And then for mitochondrial dysfunction, what diseases is it associated with? Look at this list, right? Neurocognitive, diabetes, cancer, mood disorders, cardiovascular disease, chronic fatigue syndrome. I'd even throw in that list fertility challenges. So you can see how basically not having happy mitochondria can impact so many different areas of health. And then when we look at the mitochondria pillar, again, these are all the various cofactors that we might think about when it comes to why can we have a mitochondrial dysfunction issue. But the one thing I really like to stress about your mitochondria is that it's your macronutrients, like your fats, your carbs, your proteins, that feed into the cycle. But your amino acids are a little bit different. They can come into the cycle at various points. And so that's why we see a lot of people who have insufficient amino acids, they also have low energy because they're not able to drive that citric acid cycle for ATP production. Then we have, next, we're going to move to our toxic exposure pillar. So these urinary markers, they not only look at environmental toxins.
Can I just interrupt you? Because absolutely. It looks like you're covering them. It's just important to differentiate between the organics and the metabolomics test. Mm-hmm. And what I think you're doing is that you're covering the metabolomics test now. and not the organics, because the organics seem to be a much simpler model. It's just not so that people are not confused that if they order an organics test, they won't get this overview. Am I right?
No, this is the organics.
Okay, because I don't see them like that in our system. So do you have two different reports?
So the organics, when you order that profile, this is exactly what it looks like. So what you see on the screen is what you should be receiving in terms of layout.
Okay, I have to look into that because it's not what I receive when I get an organics test, but it looks like that when I get a metabolomics test.
Yeah, no. So the difference is that the metabolomics, it has also the amino acids. And so on the front page of the report, it has an extra pillar, or it'll have different markers under that pillar. But this is actually a copy of the organics test. Yeah.
Okay. I'm just doing my due diligence here because
Yeah.
it doesn't look like that when I get it. So I need to check
understand.
you guys,
Yeah.
what is it that I'm getting when I'm doing an organics, because it doesn't look like that.
So recently, when we did the update of the organics profile, we also changed the layout as well. But all the markers that you see here, you'll be very familiar with them because they're the same markers that we had before.
Good. I'll sip up again.
No, you're fine. And we can chat about that as well. I can look to see at with the reports to see if it's an older report you're potentially taking a look at before we made that transition. Yeah, we'll take a look at it. But yeah, no, definitely. This is what the organics profile actually looks like now. So yeah, thank you for that. Yeah, and we'll chat. So with the toxic exposure, so these urinary markers, again, they can reflect environmental toxins or up-down regulations of detoxification pathways. So when they're elevated, we really want to encourage people, well, where is the source of the toxic exposure? Right? So are you getting the toxic exposure from your home, from outside of home, from water, from something that has recently been remodeled in your home life or in your workspace? So we're trying to figure out where is it coming from so that we can create a plan to reduce our exposure, but also to help to, focus on elimination of that exposure as well. And so we usually think about your detoxification pathways. So things like, do you have adequate antioxidants available for you to actually combat the free radical damage from a toxin? Do you have the appropriate nutrients to help support your detoxification pathways? And then again, not only figuring out where the exposure is coming from, but also removing that exposure from your environment as well. And then the last pillar here is going to be your methylation imbalance pillar. And so this right here that you see is just a general picture of methylation. So this is not something a part of the organics profile. It's just a picture of how methylation goes. But when you think about methylation, it's the movement of this really small molecule, a carbon attached to 3 hydrogens. And that movement of the molecule, it impacts so many things, from detoxification to your liver, to your hormones, to your neurotransmitters, to your heart. So with that impact of methylation and how it impacts those various systems, it's really important to make sure that it's supported very well. Now, when it comes to methylation, there are specific nutrients and vitamins that are needed. A lot of times we think about B9, which is folate, and B12 as well, but we can also think about things like B2 and B3 and iron and B6 and zinc, because these are also important nutrients as it relates to just methylation in general. So you can also have genetic polymorphisms. A lot of people are very familiar with your MTHFR SNP. So with the MTHFR SNP, that's an example of a genetic polymorphism, how an enzyme might not work the way we want it to work. And so a lot of times for those genetic polymorphisms, it's really about going back and seeing what cofactors are involved in that specific pathway. So again, whenever there's a methylation imbalance, these are some things that we might want to consider. Now, why might we have methylation imbalances? What are they associated with? So here's a list of things. Again, neurodegenerative disease, diabetes, cancers, cardio, neuropsychiatric or mood disorders, liver diseases, inflammatory diseases, as well as obesity. So again, whenever there's an imbalance in that methylation pillar, so these are some things that might be associated with it. And so here are some enzymes and various things that are needed to catalyze our methylation pathways. So again, amino acids not available on the Organix profile, that's mainly on the metabolomics profile, but that is something we have to be mindful of because methylation starts with methionine, which is an amino acid. And then the various cofactors, which we just talked about, the B9 and 12, we definitely think about, but also B6, 2, and 3. And then for the minerals, magnesium, potassium, zinc, and iron as well. So that is our functional pillars. So that is kind of the lowdown or the skinny or the background behind organic acids. And so I really wanted to make sure that we have a nice amount of time for people to ask questions as relates to what we covered or some other questions you may have. Remember, when we get together in January, we're really going to go into the individual markers and talk about if it's high, if it's low, what do we consider, what do we do, and how it influences the algorithm to make recommendations for the various nutrients. But like the majority of our tests, we have a really detailed support guide. I would suggest that you take a peek at if you're not familiar with it. It's a highly referenced document. But also we have the lab report, which is a podcast, and it's where doctors Patty and Michael go over a lot of various topics, but they also do dive into nutrition testing and organics and how it might be used in different diseases or different dietary styles and things like that. So I am going to turn it back over to you, and let's go ahead and start knocking out some of these questions that we have.
Absolutely. So I'm just going to clarify this, that the report that is released through Nordic is actually a different report than the one you have shown on the screen.
Okay.
So some prefer one, some prefer the others, but it's just, this is probably going to cause some confusion. But what I just want to say is that the take home message and the overview and nutrition deficiencies, etc., is the same take home message. It just looks different. It's the same markers that are measured. It just doesn't look like what you've done on the screen there. So for the next webinar, we will make sure that it's matched, so that what Dr. Powell is presenting matches what the report that you will be getting.
Yeah.
What you have done here is the new reporting that you did, and the one we are reporting is the old Metametrics report. So there is some confusions there. Having said that, the principles is the same. The markers are the same. So you are not losing out by one or the other reports. So, but yeah, we will, by January, we will make sure that there is a concordance between the presentation and the lab results that you will be getting. So I will send out an interpretation guide together with the videos. I could see a question came up on that. So the interpretation guide I will add to the slides and the recording of this presentation as well. So I've been answering some of the questions in the chat. And what's interesting, so you are bringing up these three areas, but there's even, and I guess that's what we will go through next time, there will be even more like pattern recognitions that you can, like you will move into neuroinflammation. It will be much more specific for sure. So we can all look forward to that. And now I don't remember when the date is, but it's in January.
It's in January, yeah.
We will send out the invites for that. So I'm just checking here if there was other questions. No, yeah, actually, so there were a few questions. So is this relevant for a patient who has just been through chemo? Is this relevant for someone with chronic fatigue or fibromyalgia? And my answer was, it's relevant for everybody, really, as soon as you're looking But there are, of course, some more challenging patient groups than others, and like more heavier patients, and those, of course, it becomes more relevant maybe than those who feel good and can run half a marathon without a challenge. So this test is relevant to everybody, really. So then Hannah asks the difference between the metabolomics test and the organics test. So the metabolomics test, does that has a few more markers in that? Is that
correct? Yes. So the metabolomics profile, it just incorporates an additional oxidative stress marker, but it also incorporates your amino acids. And that's really nice because amino acids, they have to filter into the citric acid cycle. They're needed for your neurotransmitter metabolites, which are markers that we do see on the Organix profile. So sometimes it can help us with that next layer of, well, why are the organic acids around the citric acid cycle low, or why do I see low neurotransmitter metabolites? So those amino acids can help us with that particular section, as well as there's the organic acid called orotic acid that speaks to us about the urea cycle. And as it relates to the urea cycle, or basically how we detox ammonia, sometimes it's because we're not having enough arginine. So again, knowing those amino acids on the metabolomics profile, that can be really helpful. But the metabolomics profile also has a few different add-ons that you can take advantage of as well. But it incorporates the organics that we just talked about, all the organic acids. It just goes one step further for the amino acids in urine.
And the add-ons are minerals and toxic elements and vitamin D and fatty acids you can add on as well. So if you want to extend the metabolomics, you can add on these, and then you get even more information. So just to sum up a little bit, because we do have 3 organic acid tests.
Mm-hmm.
So there's the organics, which is the basic one from you guys, and then you can upscale that and do metabolomics depending on what the need is for the patient and the financial status of the patient, etc. And both tests are, of course, as relevant. One is just a little bit more Rolls Royce, and the other one is maybe more Audi, or I don't know. and then we also have from Mosaic, we also have an oat test from them, and it depends on what type of patient you have. So if you have a patient where you want to do organic acids, but you also need to investigate for mold toxicity in the patient, then maybe it's more relevant to do that test because they have an offer where it's cheaper to combine those two. But if you really want to have the Rolls Royce model in regards to nutrients, you want to go for the metabolomics. And if you just want to get going and know a lot within a reasonable amount of money, you go for the organic acid tests. So it's a little bit like we have different stool tests. So you have to kind of choose the test depending on which patient type that you are sitting with. So then one asks how organic acids is relevant for people with ADHD and sleep issues. Can you allude just a little bit on that?
Oh, absolutely. Right. So one of the markers that we offer is going to be the serotonin metabolite. And so if you have somebody who has, let's say, low amounts of the serotonin metabolites or of the neurotransmitter metabolites, it could actually be rooted in amino acid deficiency, which could contribute to those specific symptoms. But also, with those conditions, sometimes it could be due to kind of gut dysfunction, right? Again, 70% of the neurotransmitters are within the gut. And so sometimes mood and behavior can result from bad bugs or even yeast being present. And so we do have markers that do look into yeast, like the diarabinitol is very specific to Candida, as well as other markers that can help suggest the need for digestive support. So I have a clinician I talk to on a pretty consistent basis who that's her whole clinic, her whole practice. It's spectrum kids, ADD kids, and behavioral disorders. And this is a standard test that this clinician particularly runs in every single one of the patients. And we also do see a lot of oxidative stress for patients with young kids who have like behavioral disorders and who might be on the spectrum and ADD as well. And so then it allows us to say, okay, you have high oxidative stress. What is the root cause? Where is it coming from? We also typically see for that patient population a lot of methylation imbalances as well. And so always, looking into that to see how things are going for that as well.
And then you said 4 days without water-soluble vitamins. But what about like minerals and yeah.
So for minerals and things like that, we might have to wait a little bit longer, especially if they're fat soluble. So sometimes it's more looking at a 3-week time frame to stop supplements. But what we usually say is the water soluble ones like vitamin C and your B vitamins, those are the ones that, change really quickly, that are really nice to get a baseline, and it won't really disrupt your patient's supplement regimen too bad, versus if you tell them to stop it for a full month. But again, that's really up to you. But either a full month, around 21 days or so, if you would like to really get a baseline of all supplements. But if you want to get just a baseline of the water soluble nutrients, again, the B vitamins and vitamin C, you can go ahead and stop them for about 4 or so days.
Excellent. Good answer for that. So I think that's all the questions that has been popping up during your presentation. And I'm sorry, everybody, that we just got some, but now we've got it solved and we are ready for 2024.
Sorry.
And but rest assured you will get further education. And also, just for those of you who can't wait until next year, then we already do have some presentations. There is one that Richard Lord did a few years ago, and he's actually he's the grandfather of the organics.
Yes, he's the brain behind it all. Yes, he's the main person. If you ever see the room with Dr. Lord, whew.
Okay, exactly. So you can log into VMS, and under education, all these webinars are located, and you can, if you put in organics, then you can find that. And there's also some other, I think there's 2 webinars, which was, what's his name? No, I can't remember who did it, but we have 2 webinars on metabolomics as well, which is again covering the same concept that you can go in and look at as well. So there's probably at least another 3 hours education that you can entertain yourself with before the new year. So then Rimor just comes up with a question here at the end. In blood tests, if a blood test show high ALAT and ASAT, those are the liver markers, I can't remember if they're the same in US, and too much cobalamin and too high ferritin, is this test good for that? So actually that opens up for the question that you can have a high cobalamin in blood, but you can in an organic acid have an indication that there is a B12 deficiency.
Exactly. And we see it all the time. We see it all the time, actually. And, in blood, when we're measuring cobalamin, it really makes me wonder, is the patient able to do something with the cobalamin, right? So if they have, let's say, a genetic SNP, then the cobalamin might not be the right form of the B12 they actually need, and their body can't use it. So it's just like, what do I do, right? And we see it all the time when you think about patients that have adequate B12, but their homocysteine levels are elevated. Well, what does that mean? Again, you have appropriate amounts for people of like age and gender, but your biochemistry is still asking for more.
So with the B12 marker, which B12 does that relate to? Is it the hydroxy B12?
Right, yeah, so that's a really good question. So the B12 marker on our profile, what we're doing is we're just looking at B12 in general. And so if we see that there's a lot of methylation things going on, then we start to question about the actual methyl form of that B12, okay? But our profile just looks for B12 in general. Great question.
Super. So with that, I think we just increase the appetite for the 2024. I hope. So again, we will send out the recording and the slide deck, and I will send a link to the interpretation guide. And hopefully see you next week on the mold toxicity webinar. Look out for the invites and sign up as soon as possible. So take care, everyone, and bye for now. And thank you very much, Dr. Powell, for this presentation.
Thank you. I had fun. Enjoy, everybody.